Welcome to Nurses Showdown, Clinical Knowledge Battleground. I'm super excited to have two amazing nurses here with me. These two nurses are going to be competing for a grand prize of up to $200. And they also get to go home with a Gemsy scrubs. So yes, I have Stephanie here with me, a nurse representing the ICU. And she also has, other backgrounds, but I'll let her tell us herself. And I also have Marcel here, a nurse representing MedSurg. So these two nurses are going to be facing off over 10 clinical case studies, and we'll get to see who wins the grand prize. All right, Stephanie, go ahead and tell us who you are, how long you've been a nurse, and what your nursing background is.
Hi, I'm Stephanie. I've been a nurse for, I'm going to show how great I'm going to be at answering these questions. I think we're going on like 8 years now. Just recently transferred into the ICU, so don't let that intimidate you.
How long?
I just transferred into the ICU. My specialty was a step-down unit on a neurology floor. And so now I'm just broadening my horizons, and clearly I like to challenge myself, or I wouldn't be here right now.
That's right. Good. And this will be a good challenge too. Okay, Marcel, let us know who you are, how long you've been a nurse, and what your nursing background is.
Oh God, I'm Marcel. I have been a nurse. I'm going on for 10 years this year. I started at the SNF because my hospital didn't hire for associates before, so I had to take some schooling, and then eventually got to the hospital, and I've been there for 8 years, going to 9 years this year. And I've done hospice. I've also done, I've just been in MedSurg at the hospital and trauma.
Okay.
But it feels like psych and SNF nowadays, so.
With the patient population you guys have been dealing with.
It's 75% psych, basically, so.
Okay, so then that means some of the psych questions that you may answer should be easy breezy.
No.
All right. Thank you both for coming. Thank you both for joining us. And I really appreciate you being here. Okay, now, so let's go over the rules. Okay. All right. So, are we ready?
Yes.
Very good. Very good. All right.
Got my pen and my paper.
No.
Okay, so before we get into the questions, I just have to go over a little disclaimer. So, this show is meant to be entertaining, educational, and engaging. So for our viewers out there, please by no means use any information here as the sole basis or the primary basis for your nursing practice. It can be used as a supplemental information, but do not base your nursing practice on the information you get from this show. So just take it for what it is, entertainment, learn one or two things, and engage. All right? Make sure you are following your hospitals or your facilities protocols, guidelines, and policies. And of course, your doctor's orders. All right. Are we really ready now?
Yes.
Okay, perfect.
No.
All right, let's get this show on the road. All right, so I'll start with myself. Choose a number between 1 and 10.
Let's do 7.
7, the lucky number 7.
Yup.
Okay. Number 7. I guess you already have the first answer option. You're 34-year-old after a motor vehicle collision becomes acutely hypotensive and hypoxic with absent breath sounds on the left and tracheal deviation to the right. The patient is on high flow oxygen but deteriorating rapidly. What is the most appropriate immediate action? A. Obtain a chest X-ray first. B. Perform immediate needle decompression and prepare for chest tube insertion. C. Prepare chest tube insertion. D. B and C. You have 10 seconds.
Oops.
Okay. 3, 2, 1. Show your answers. D. Okay. Marcel, this is your question. Why did you choose D?
He sounds like he has a pneumothorax and he needs to decompress right away. And I have a chest tube to remove all that blood in the cavity.
Okay. All right. Stephanie, you also chose D. Why did you choose D?
Well, I'll be honest, I really didn't like the answers to this question. I felt like I was back taking the NCLEX. I was like, I picked D because, well, that's like, if you don't do that, the patient's really going to deteriorate. So that's why I picked D.
Okay. All right, Marcel, you gave it a diagnosis. Patient is having a pneumothorax. And D, you both chose D. Now, let's see if you're both correct. Answer reveal coming right up.
Yes.
D.
Okay. I thought B was a trick question because I was like, I'm not gonna perform a needle.
Yeah, that's true.
Somebody is.
Somebody is, but it won't be you.
We're just gonna help them.
All right, so you give nebulized. Wait. Why is he giving me that option? That's not the give nebulized bronchodilator, albuterol, and reassess oxygenation. No, that's not it. But that's not the.
I mean, you could try.
Not for a patient that is already rapidly deteriorating. Oh goodness. Okay. All right. So, but that's not the correct answer for D. But anyways, here is the rationale for your D answer option. Clinical signs of tension pneumo is hypotension. All right, very good, Stephanie. Choose a number between 1 and 10.
3.
3. Okay. Question number 3. During hemodialysis, the patient complains of severe back pain and nausea. What should the nurse suspect? A. Air embolism. B. Dialyzer reaction. C. Disequilibrium syndrome. D. Hypoglycemia. You have 10 seconds. Write your answers. Three, 2, 1. Show your answers.
Can you see?
It's kind of blurred.
Oh.
Oh my god.
Okay, so you
I
chose
chose C.
C? Okay, so you both chose C. All right. So, Stephanie, why did you choose C?
I wish I had a great rationale for you. I just did process of elimination and what kind of made the most sense. And I've honestly never heard of disequilibrium syndrome. So I am just excited to learn. Glad I took this one. That's my rationale.
Okay.
I hope she has a better
answer for it. Okay, all right, that's a nice rationale. Okay, Marcel, why did you choose C?
I haven't heard of that syndrome before, but I just base it on the signs and symptoms.
Okay.
Sound like this equilibrium kind of sounds like, you might get nauseous or like, I don't know.
Okay.
Maybe like a shift in the electrolytes,
Yeah,
that's what happens with dialysis.
Okay.
Yeah.
Sometimes.
Like motion sickness.
Yes. I was tying it to that.
Is that another way of saying motion sickness? Because if it is, oh goodness.
I'm having this equilibrium.
All right, well, let's see if it's another way of saying motion sickness. Here is your answer reveal. Let's see if you're both correct.
Are we losing $10?
See? Wow, nice guess.
We're great nurses.
You both guessed correctly. All right, let's see what that is. Let's see why. Dialysis disequilibrium syndrome occurs due to rapid solute removal causing cerebral edema. Symptoms include headache, nausea, and back pain. There you go.
Sounds like motion sickness to me.
A severe case of motion sickness.
A severe case of it. There you go. All right. Wait, at least you both learned what this equilibrium syndrome is now. There you go. Okay. Marcel, choose a number between 1 and 10.
Let's go with 5.
Number 5. Okay. Question number 5. The patient on oxytocin develops uterine tachycystole, more than 5 contractions in 10 minutes, and late decelerations occur? What is the best action to ensure a smooth transition?
This is OB.
A. Stop oxytocin. So this part where it says what is the best action to ensure a smooth transition doesn't belong here. I'm not sure what it's doing there, but yeah. But what is the nurse's priority action? A. Stop oxytocin. B. Reposition the mother and give oxygen. C. Begin maternal pushing efforts immediately. D. A and B. You have 10 seconds. Three, two, one. Show your answers. Okay.
Oh, I should write it bigger. I'm sorry.
What'd you? Oh, D. Okay.
D.
Okay, you both chose
I'll write
D.
it bigger from now on.
All right, Marcel, why did you choose D?
It sounds like it makes sense. I don't know.
Okay. Okay. All right. What? You don't know?
No. I do have a
good
when I was having D cells with my last baby, and they basically started having me reposition and started giving me oxygen. So
okay. All right. Were you on oxytocin?
I don't even remember. Everything's such a blur.
Okay. All right. Well, let's hope you're correct. Stephanie, why did you choose D?
I chose D. First of all, I don't know anything about OB, but I did enjoy it in nursing school, so I was trying to channel back into my textbook. And I know late D cells aren't good, and I don't know, B just called out to me, and then D came up and said A and B, so I was like, well, maybe it's A and B. So
okay,
that's how I came to that conclusion. However, I'm not sure.
All right, good process of elimination, right? All right, so let's see if you're both correct. D, you both are correct. Wow, you guys are all right.
That's how you pass nursing school,
right?
Just kidding. No, you don't.
You guys your way through nursing school. All right, so let's see why. Uterine tachycystole can reduce uteroplacental perfusion and cause late decelerations. Immediate actions include stopping oxytocin, intrauterine resuscitation by repositioning, providing oxygen and IV bolus, and notifying the provider. Tocolytics may be used by protocol if tachycystole persists. All right. Very good, very good. Now you do know. Right?
Still don't understand the verbiage.
Now if you ever come across a question like this, now okay. Now I know. I'm not guessing anymore.
I did not like OB. It was traumatizing.
All right. So, Stephanie, choose a number between 1 and 10.
Let's go with 8.
Number 8. Okay. Number 8. A 52-year-old male remains unresponsive 90 minutes after a short anesthetic. Vitals are stable, blood glucose normal, pupils equal and reactive, no residual neuromuscular blockade was documented. What is the most appropriate immediate action? A. assess for residual anesthetic effect, check temperature, review medications, and notify anesthesia for possible metabolic causes. B, assume patient is sleeping and leave to recover naturally since vitals are stable. C, document as normal and proceed with discharge. D, B, and C. You have 10 seconds. Three, two, one. Show your answers.
I said I was gonna write it bigger.
Okay.
and I forgot.
Okay, you both chose A. Stephanie, why did you choose A?
If a patient remains unresponsive 90 minutes after a short anesthetic, I don't think I want to assume he's just sleeping and then go home. I think I should do a little bit more assessing to see why he's so unresponsive.
Okay.
Even though the vitals and blood glucose and those assessments seem to be normal.
Okay. Perfect. Marcel, why did you choose A?
Because the other answers don't make sense. And plus, the first thing that you do with nursing intervention is to assess a patient, right? So
okay, assess. You can never go wrong with assessing.
Yep.
You can't over assess, I guess. Okay, well, let's see if you're both correct. Yes, you both are. All right. Assess for residual anesthetic effect, check temperature, review medications, and notify anesthesia for possible metabolic causes. And here is why we will do this. Okay, delayed emergence has multiple causes. Residual anesthetic. Delayed emergence has multiple causes. Residual anesthetic or sedative agent, hypothermia, metabolic derangement, or neurologic event. A systemic assessment, airway breathing, glucose temperature, medication review, and prompt communication with anesthesia are required to diagnose and treat the cause. Leaving unattended risks miss deterioration. Okay. Very good, nurses. Marcel, number between 1 and 10.
I'll pick 1.
Okay. Okay, question number 1. A patient's AV fistula is noted to have no bruit or thrill before dialysis. What should the nurse do first? A. Proceed with treatment. B. Attempt to flush with saline and notify provider immediately. C. Notify the provider immediately. D. Apply a warm compress and wait for 10 minutes. You have 10 seconds. Three, two, one. Show your answers.
I keep forgetting to make it bigger.
C, D. Now we have a competition. Okay. Okay, Marcel, why did you choose D?
I don't know. I was going for C, and then I changed my mind. I just figured maybe it clotted, and maybe I should notify the physician. But I was thinking maybe I should try to see if I can do any intervention, and then notify the physician if it doesn't work.
Okay. All right. It is a rationale. Yeah. Okay. Stephanie, why did you choose C?
I do like her rationale, but I personally, I don't know. I've never, I guess, been in that situation, and I don't. So I don't, can't think of that being an intervention. But I mean, it sounds very reasonable after hearing her.
Help me on that.
So honestly, I don't know. I didn't pick it because I just wasn't sold. It was between C and D, and I just went with C because healthy competition.
Healthy competition. Yes. Yes. Okay. All right. So you want to do something first before notifying the provider, and you want to notify the provider immediately. Like, okay, there's trouble. Come. All right, well, let's see.
But then the provider might get mad at me and say, like, well, did you try applying a warm compress and waiting 10 minutes?
What? No.
We're going to find out.
All right, so let's see which one of you is correct. Here is your answer reveal. C.
Oh, I don't know the answer.
Wow. Okay, Stephanie.
I want to know why.
You want to know why? Okay, here is the reason why you will notify the provider. A lack of bruit or thrill indicates possible thrombosis. The nurse must not cannulate and should notify the provider immediately for evaluation. So for thrombosis, I mean, what can really a nurse do? It requires the attention of the provider.
We need to have
Yep.
I'm not getting yelled at today.
Okay, so that was question 1. You got C. Whose question was that? Oh, that was Marcel.
I'm glad I didn't go for that first. I would have been negative.
You knew it.
I know.
All right, so Stephanie, choose a number between 1 and 10.
Is 4 still available?
Yes, it is.
Okay, let's do 4.
Okay. Okay, question 4. An 18-month-old toddler with multiple days of vomiting and diarrhea is mildly dehydrated but able to take some liquids by mouth. What is your appropriate immediate action? A. Offer oral rehydration solution and small frequent feeds. Reserve IV fluids for moderate severe dehydration or inability to tolerate ORS. B. Suspect gastroenteritis and immediately start large volume IV bolus for the patient. C. Withhold fluids to rest the gut. D, B, and C. You have 10 seconds. Three, 2, 1. Show your answers. Okay, you chose A, Stephanie, and Marcel chose D. All right, Stephanie, this is your question. Why did you choose A?
Oh, it's my question. Okay. Why did I choose A? First of all, I don't know anything about peds either. And I'm not a mother, so I don't know. I liked the way it sounded. It sounded like a good answer. I didn't pick C because I didn't know if they meant like all fluids, like IV fluids as well, or like just PO fluids. And I didn't know if I should jump the gun and say it's gastroenteritis. I don't know what gastroenteritis would look like in an 18-month-old, so I picked A.
Okay. All right. Marcel, why did you choose D?
Um, it just sounded right. I don't know what multiple days is, but I know that it's important for babies to hold fluid, because aren't they like a good percentage of them is like fluid, so it's really important to give them fluids right away and suspect something.
Okay.
I don't know. Just to keep them hydrated so they don't go into shock.
Very good rationales.
All right.
Maybe my ORS won't stop that, huh?
It's okay, I'm a mom, that's why.
I'm not. I don't know anything. Good luck. 18 with those.
But I hated peds.
Okay, so I mean, we don't have a diagnosis yet. So we just have a kid who is vomiting and having diarrhea. So they're dehydrated. So we're trying to fix the dehydration.
I want to prevent shock.
Okay, all right. Well, let's see which one of you is correct.
That sounds right. Now that we're talking about it,
right?
Immediate. Keyword is immediate.
Immediate. All right. So let's see.
Oh God.
Hey.
Damn! Don't feel bad. Oh no.
I was like, this sounds okay, but
it also said mild dehydration.
Yeah, because remember the kid is still able to tolerate oral feeds, right? So offer oral rehydration and small frequent feeds. Reserve IV fluids for moderate to severe dehydration or inability to tolerate. So rationale. For mild to moderate dehydration in children, oral rehydration with WHO or pediatrics ORS is effective and recommended. IV fluids are reserved for severe dehydration shock or when the child cannot tolerate oral intake. Avoid hypertonic or high sugar fluids, e.g. undiluted soda for rehydration. All right. So, whose question was that? That was
I think that was mine.
Okay, so Marcel, you're next. Choose a number between 1 and 10.
Let's go with what do we have left?
So we have 2, 6, 9, and 10.
Okay, I'll go with 6.
Okay. Question number 6 coming right up. Okay, question number 6. During shoulder dystocia.
Another OB.
Let's stop right there.
I'm sorry. Okay.
During shoulder dystocia, which of the following maneuvers is contraindicated because it may worsen impaction? A. McRoberts maneuver. That's maternal leg hyperflexion. B. Suprapubic pressure.
What we're talking about. Okay.
C. Fundal pressure.
God.
D. Delivery of posterior arm. You have 10 seconds.
I don't know.
3, 2, 1. What's your best guess? Choose your answer.
That's my best guess.
Okay.
My B.
B.
I don't know.
Okay. So Marcel, why did you choose B? There has to be a reason why you chose B.
I was in between B or C because I feel like A is what they need to do, and then D, I don't know. I wasn't so sure about that because it's already their shoulder.
But why
I don't know.
suprapubic pressure? What
feel
led
like
you
if
to
you're
that answer?
I feel like if you push it up suprapubic, it's going to like dislocate their shoulder even more. I don't know.
Okay. Okay. Okay, Stephanie, why did you choose D?
I don't know.
You don't know.
I figured out eventually this is an OB question. At first, I was thinking it was like a shoulder dislocation, and then the answers started coming. And I was like, okay, I think this is OB. And I was like, okay, I think the baby's not right, and one of the arms is probably stuck, and I don't know what is the arm that needs to come out, or maybe no arms need to come out, like another part of the body needs. I don't know anything about OB. So that's why I picked D.
Okay, all right.
That's my rationale.
Let's see which one of you guessed correctly.
Probably D.
No, I.
All right, let's see.
Let's see what it is.
Fundal
Fundal
pressure.
You were so
I almost picked that.
What type of pressure?
Why did I change my answer again?
Let's find what shoulder dystocia is.
Yeah.
Google. And stop changing your answers.
I know, right?
Well, let's see why we don't do fundal pressure when there is shoulder dystocia involved.
Don't. So you deliver the posterior arm. Okay.
Yeah. Fundal pressure is contraindicated in shoulder dystocia as it can further impact the anterior shoulder and worsen cord compression or fetal injury.
Oh,
McRoberts and suprapubic pressure are first line. Delivery of the posterior arm is used if initial maneuvers fail.
Okay.
Yeah.
McRoberts, that baby.
Yeah, so you don't do fundal pressure.
Don't do fundal pressure.
Yeah. And sometimes when you get an upgrade from L&D to like ICU or even to the floor, you send every so often there has to be an L&D nurse or postpartum nurse who comes down to do fundal pressure. So, but when there's a baby still in there and the shoulder is stuck, you don't want to be pushing on your uterus for that.
That makes sense.
Okay.
Good to know.
Yep.
But I'm never going to OB, so I'm just kidding.
Doesn't mean it won't come to us though.
Huh?
Right?
Exactly. You won't go to them, but trust me, they'll come to you.
They do. They do.
So intimidating when they're there.
Yeah.
Yes.
All right. Stephanie, choose a number between 1 and 10.
9.
9. Okay. Number 9 coming right up. Okay. Question 9. A patient on continuous renal replacement therapy. Oh, this is right in your alley, Stephanie. Continuous.
I said I just transferred.
Continuous renal replacement therapy develops rising transmembrane pressures and decreased circuit clearance, and the machine. A what?
Oh, nothing.
Oh.
Sorry.
And the machine alarm indicates clotting. The patient remains hypotensive and on vasopressors. What is the most appropriate immediate action? A. Ignore the alarm and continue therapy. B. Assess vascular access and circuit pressures. Consider regional anticoagulation and changing the circuits, and notify nephrology. C. Increase ultrafiltration rate to clear the circuit. Oh, that word is tripping me. To clear the circuit. D, B, and C. You have 10 seconds. Three, two, one. Show your answers. Okay, you both chose D. All right, Stephanie, why did you choose D?
I chose D. Well, one, don't ever ignore your CRT alarm. I know that. I don't do CRT, but I know that.
Okay.
And as Marisol has said before, your first action is you always assess. So I know for sure it has to be B. C, I'm not too sure about. I feel like that could be tricky because I don't know if I would want to increase the rate if it's already not working. So I could be wrong there, but I just picked D because maybe I do have to do that.
Okay.
We'll see.
Okay, all right. Marcel, why did you choose D?
On the question, it's talking about clotting, so then I just kind of went for B at first, and then I saw the last choice was B and C, so could it be B and C? Or could it just be B? Oh crap.
It could be B or it could be D. I don't know.
Because I feel like, and you never ignore alarms with anything, and now I feel like you shouldn't increase the ultrafiltration rate because I feel like that should be nephrology's job. Oh jeez. Can I change my answer?
Nope. All right, well, let's see if you're both correct. Drum roll.
I don't want to see.
I just be.
B.
Oh my god! I knew it. Dang it! I changed my answer again.
We talked about this.
I know.
And I should have listened to myself too because I wasn't sold on C.
Always trust your instincts.
Both were sold on C. Oh man.
All right, so assess vascular access and circuit pressures, consider regional anticoagulation or changing the circuit, and notify nephrology. And here is why we will do this. Clotting of the CRRT circuits reduces clearance and may reflect access issues or inadequate anticoagulation. The appropriate response is to assess access and pressures. There you go. Is to assess access and pressures. Consider regional anticoagulation or circulate change, and involve nephrology/CRRT specialists. Stopping vasopressors or increasing ultrafiltration could worsen hemodynamics. Ignoring alarms risk loss of therapy and complications. There you go.
Okay.
All right.
Now we know.
Marcel, you're next. Choose a number between 1 and 10.
What do we have left?
We have 2 and 10 left.
I'll go with 10.
Okay. Question 10. Oh, this is right in your alley, Marcel.
Oh gosh.
A
This is also ICU.
A TC spinal cord patient has sudden hypertension, headache, and sweating. What is the most appropriate immediate action? A. Sit patient upright, check for bladder or bowel triggers, loosen clothing, notify provider immediately. B. Lay the patient flat and check for bladder bowel triggers, notify provider immediately. C. Losing clothing, notify provider immediately. D, B, and C. You have 10 seconds.
This is a horrible set of answers.
3, 2, 1. Show your answers.
I don't like this.
Okay. What did you choose? D. Okay, Marcel, why did you choose D?
I don't know. I feel like this patient has cord compression, right?
Okay.
No, I'm not too sure about laying the patient flat because I feel like that would just elevate their blood pressure even more. But I just know that we need to release the bowel and bladder and notify the provider immediately and loosen clothing.
Okay.
Just to release any pressures.
Okay.
But I don't like how the laying of the patient. I don't know. I'm not too sure about that.
Okay. All right, but you chose D, and laying the patient flat is one of the answer choice for that.
I know.
Okay. All right. Stephanie, why did you choose A?
I just picked A because it sounded different from B, C, and D. So I just went with the total opposite of what the answers were telling me. So either I didn't get the memo or we'll find out. I don't really know.
Okay. All right. Well,
but I understand about the like pressures, like usually hypertensive, like, so I don't know. The position is what's kind of
okay.
The only thing that's different with all of these answers. So I'm not too sure what's the correct position to put this patient in.
Okay. All right. Well, let's find out.
We'll find out. You lay them flat, sit them upright. I don't know.
This is more like acute rehab-ish type thing.
Yeah, after a spinal cord injury, right?
Yes. All right. So let's see.
I know it's like a syndrome that they experience.
Mm-hmm. Yes. Your answer is A.
Oh my god.
All right, Stephanie.
It's only because B, C, and D all sounded alike. So why would you need 3 answers to be the same? I don't know. That was my thought.
That was a good one, though.
Right.
Again, that was my first answer, but then I was like, sit the patient upright.
But I get it, though, because like usually if a patient's hypertense or like you want to like relieve pressure, I get it. Like the thought process of why you'd want to lay them flat, thinking that would relieve pressure.
Yeah.
So.
All right. Well, let's find out why.
I want to find out what's going on.
Autonomic dysreflexia. That's what the patient is experiencing, and it's life-threatening. Immediate upright position, remove triggers, and notify provider. Okay. So
I couldn't think of the name of it. I knew it was something.
We knew the signs and symptoms.
Yeah.
We knew signs.
At least you even know what to do,
we
right?
know what's wrong.
Yeah.
We just don't know the name. We know how to fix them, though.
Mm-hmm. Oh, you don't even know why. I know what's going on with you. Actually, I don't know what's going on with you, and I don't know why, but I know what to do.
We're gonna go back to work saying all of these like fancy names. You're going through autonomic dysreflexia.
Patient will be like, what? Hold on, what?
All right, Stephanie, you have the last question. That's question number 2.
Let's go with 2.
2. All right. Okay, question number 2. A 9-month-old infant with wheeze, cough, and low-grade fever, presents with moderate respiratory distress, and O2 saturation is 92% on room air, what is the most appropriate immediate action? A. Start a broad spectrum antibiotics immediately. B. Routinely give albuterol and systemic corticosteroids to the patient. C. Provide supportive care such as hydration, suctioning of secretions, oxygen if saturation is low. Avoid routine bronchodilators or systemic steroids unless specifically indicated. D. A and B. You have 10 seconds.
Oh, well, I don't know now. I'm just gonna roll with it.
3, 2, 1. Show your answers. B.
Do we both take D?
Okay.
Sorry.
All right. You chose D, Stephanie. Why?
Well, first I was like super confident because I was like, it's an immediate action, and C kind of seemed like something you would do later. But then I realized C says to do like what B says not to do. So now I'm really not sure, but that's why I picked D, because that's why I was confident. Then I was like, oh wait, no, I'm not so sure.
Okay. All right, Marcel, why did you choose B?
I did not like the word routinely, but I kind of just wanted to fix the oxygen saturation and the wheezing. So I felt like maybe the albuterol would help with that, and the steroids. But then I completely forgot that says the D say A and B. So maybe he's starting to have like infection too. Yeah.
Okay. All right, let's see which one of you is correct. C.
D.
C is correct. All right, so provide supportive care, hydration, suctioning of secretion, oxygen if saturation is low. Avoid routine bronchodilators or systemic steroids unless specifically indicated. And here is why.
I knew it. I realized after. It's like my confidence went.
Guidelines recommend supportive care for bronchiolitis. That's what the patient has. Maintain hydration, nasal suctioning, and give supplemental oxygen when needed. Routine bronchodilators, epinephrine, or systemic corticosteroids are generally not recommended in typical bronchiolitis. Imaging and viral testing are often unnecessary and do not change management.
Bronchiolitis.
Yes, ma'am. Okay. Bronchiolitis. Okay.
We don't give babies stuff. Oh my gosh.
Okay, so we've gone over all 10 questions and we have a clear winner. The winner is
Marissa.
Stephanie. However,
Look at the Jonesy though.
She's a winner. She's the real winner. She's getting Jonesy's girl.
But there was that one question, I believe it was question number 4, the one where I said that's kind of debatable with the oral rehydration solution, the baby who's not tolerating. So to fix that, this is not a tiebreaker question, this is more like a replacement question, right? Okay, so let's go over that question. The answers came out first. All right. Okay. So what is doxyl aminosuccinate? And here are your answer options. A. Brain tumor containing both oligodendrocytes and astrocyte cell types. B. Relating to movement of charged particles through a medium under an electric field. C. An antihistamine used for allergies and commonly as a sleep aid. D. A chemotherapy and immunosuppressant drug. You have 10 seconds. Three, two, one. Show your answers. C. D. Okay. Why did you choose C, Stephanie?
I know that there's a antihistamine, and I'm a night shifter. you can use its doxysalamine. So I don't know if it's the same medication. I've never seen doxysalamine succinate, so I'm not sure. That's why I went with C, because the first part of the medication sounded familiar to me. That's why I went with C. But it could be C or D.
Okay. How about you, Marcel? Why did you choose D?
I don't know. I initially thought that it was C, but then I changed my answer to D because I was running out of time. I changed my answer again.
Oh my gosh. Okay. All right. Well, let's find out which one of you is correct.
This is the most important lesson of this show.
Right.
What are we gonna give her patience?
Well, we'll see. I might be wrong. We don't know.
All right. Let's find out.
Don't lose hope in yourself.
C.
Okay.
Yay! It's a sleep aid.
It's a sleep aid. Yeah.
It's a fancy way of saying, like,
yeah.
I don't know which brand it is.
A Ziquel, something. And it's also used for allergies. Yeah. It's an antihistamine you can get over the counter.
I don't remember the brand, because I think Ziquel is probably diphenhydramine, but I don't know what's the brand for the doxycycline one.
Or it could also be like Mucinex, because it can also be used for like all those multi-symptoms, allergies.
Like a decongestant, the allergy symptoms,
Yeah. There you go. Okay.
I really like pharmacology for some weird reason, so. My mom was a pharmacy tech.
That was the one I struggled the most.
But the succinate got me. I was like, that sounds like you're gonna get paralyzed. I don't know. Well, that makes sense. Sleep, It's a form of paralysis. Okay, I'm gonna stop.
All right. So that concludes the show, and we have a clear winner. It's Stephanie. Congratulations,
Thank you.
Stephanie, and congratulations to you too, Marcel, because you get to go home with a Gemsy Scrubs. And your total winning, Stephanie, is you go home with $150. Congratulations! And I hope you all had a good time.
I did. It was really fun.
Good. So that wraps up our today's episode. Congratulations to our contestants for demonstrating rapid critical thinking and excellent patient care instincts. Remember, do not use any information here as your primary basis for your nursing practice. Be sure to always follow your facility's protocols, guidelines, policies, and of course your doctor's orders. Thanks for watching. Don't forget to like, subscribe, tell a friend to tell a friend, share, put in 1 or 2 comments here and there. And until next time, have a fabulous day. Thank you. Bye-bye.
Thank you. Thank you for having me.
Don't change your answers.
Don't change your answers.
Change your
Always
answers.
trust your gut.
Follow your gut. Trust your gut.
Right. All right. Bye, you guys.
Bye.
Bye.
See ya.